First question that I have is about a kind of serious hair topic that I've heard of, scarring alopecia. What is it, and how do I go about talking about it without getting slapped at an award show and making sure I keep everybody's wife's name out of my mouth? What's going on, everybody? My name is JC Mendoza. I am your host, and this is Uncomfortable Questions. With me today is board-certified dermatologist and specialist in men's hair loss, Dr. Knox Beasley. Dr. Knox, how are you doing today?
I'm doing good. How about yourself?
I'm doing good. I'm doing great. Now that I have you here with me, I have so many questions, and I'm glad that you can help walk me through them. But what is scarring alopecia? And I promise throughout this, I will keep your wife's name out of my mouth.
So when we talk about alopecia just means hair loss. And so we have non-scarring and we have scarring types. So a non-scarring would be like a male pattern hair loss.
Right.
When we talk about scarring, though, what this is it's a type of hair loss that causes a permanent damage to the hair follicles that eventually can cause irreversible hair loss.
Right, got it. And what would be a cause of scarring alopecia? What's something that causes that?
So inflammation is the big driver. There's a lot of inflammation in the scalp. There can be contributing things like autoimmune conditions, trauma, infections, and things like that. But inflammation is the big driver.
But how do you know when you're dealing with scarring alopecia? Like, what are some symptoms?
Yeah, so this is really important because when we talk about, say, a male pattern hair loss, you still have that hair loss. It's slow, it's progressive, it starts on the crown, it can affect the frontal scalp. Scarring alopecias can also start on the crown of the scalp as well. But typically you're going to see other symptoms like irritation, tenderness, like a burning sensation. It's going to be symptomatic, whereas your male pattern is just hair loss. You're not going to have those symptoms.
Yeah.
So early intervention of these things are really important. And so recognizing that, like, I have hair loss, but I'm also having these other symptoms is really critical.
Right. So even though hair loss might be something that happens, the sensations that you mentioned, if those are happening, those might be one of the things that would alert you that you might be scarring.
Right. And that you need to get in and see someone.
Got you. And is it possible to treat scarring alopecia?
This is where it can be difficult because the goal of treatment is to stop the progression. If we can get hair to come back, that's icing on the cake. And that's always something we want. Let's get you as much hair as we can have.
100%.
But really the goal is stop any further hair loss. And there's a lot of different ways we can do this. This is something that needs to be treated by a dermatologist. This isn't something I would try and do at home. I would come on in. Whether that's topicals, pills, injections, medicated shampoos. These are all things that are geared to really shut down that inflammation, calm it all down, and stop that progression. And then, after that, or sometimes during, we can try to work on getting some hair back as well.
That makes sense. So what if I came in and I was in fear that I was suffering scarring alopecia and you were my dermatologist? What would you recommend for me?
So obviously we'd start with a really good hair exam. We check out the parts, we look, and I'm looking for specific things like, do I see inflammation around your hair follicles? There are different clinical features that we're looking for. If we need to, you can do a scalp biopsy. What that is, we know up your skin, we take a little piece of it, we send it to the lab, and they'll be able to tell us if, this does look like a scarring alopecia. So that's usually what it is. If it's been going for a while, sometimes you can look and say, I'm pretty sure this is scarring. Maybe we'll do the biopsy to make sure, but I'm really worried about this.
That makes sense. And you said that would usually start like in the crown, that's like behind?
A lot do start on the crown. They can start on the front as well too. So that's why it can sometimes seem like you maybe I just have male pattern hair loss, but it's that symptoms, or if I'm like, man, my scalp's really red. Those are indications that really you need to get in, because the quicker we can start treatment, the quicker we can shut down that scarring process. And that's going to keep you, as much hair as possible.
Right. Makes sense. So big takeaway, if you're experiencing anything like what you perceive as hair loss, in addition to the symptoms that we mentioned, like inflammation, definitely go to your primary care physician, go to a doctor, go to a dermatologist. I'm lucky enough to be here with Dr. Knox Beasley, but go find your Dr. Knox Beasley. And I just learned that it might start in the crown, but no matter what, it's still a crown. All right. You're still a king or a queen, and you deserve all the answers that you are looking for. And you'll find them right here on Uncomfortable Questions, and we'll promise to be back with many more.